And welcome to another episode of Ortho Evidence. My name is Mo Bandar, I'm the editor-in-chief, and I'm here today with another update or specialty series update. Today we have an update in sports medicine with a friend and colleague, Dr. Femi Ayeni, who is the chair of orthopedics at McMaster University. He's has a long history of surgical scientist efforts and specifically in many ways has moved the field forward in numerous areas. Many of you may know of his work in hip arthroscopy, but he certainly does expand his academic activities far beyond that. Femi, welcome so much to Ortho Evidence, and thanks for taking time with us today.
Thanks for the introduction. Always good to be with you, Mo, and thanks for the kind words as well.
So why don't we begin with the first of three simple questions, and I presume they're pretty simple for someone who I know is as well read and as involved in the academic sphere and sports as you, Femi. What's trending right now, or what things are on your radar with respect to sports medicine? And I suspect you'll speak maybe to the sphere of hip, but certainly anything's open.
Yeah, I think, the continuation of the concept of joint preservation and how do you preserve your own joints to last as long as possible. And I think in the hip, it's quite important. And I think Brian Kelly said it once or recently where he said, somewhere along the middle of the last century, a great operation was invented, the total hip replacement. And as a result, hip preservation kind of fell off the map. And everybody just sort of forgot about it. And now we're revisiting it. So when you ask about three trends, I'd say, first of all, the continuing trends of trying to understand what big data can teach us as we're all doing more hip arthroscopic cases. Are we able to identify prognostic factors that help us understand how well we're doing and how the outcomes are? I think the pandemic has really driven up the adoption of virtual training and virtual meetings and really understanding what the future holds to be interesting, because there certainly will be a component of remote learning and remote education, and how that gets adopted is going to be interesting to see. And finally, I think really trying to enhance surgery with biologic technology, whether it's in cartilage restoration or soft tissue augmentation, will continue to be a force to be reckoned with academically anyways.
And I have a parallel to your point with respect to the statement that total joint replacement in many ways changed the focus away from joint preservation with respect to the hip. Well, if you think about hip fractures in the same way, Femi, you can think about the fact that fixation was such an important part of the early part of the last 50 years of trying to figure out how do we operate and fix the hip and retain the normal anatomy. But once the procedures of hip replacement, and particularly total, and then sort of the hemis came into place, people abandoned the concept that surgical fixation is really a viable alternative. We're seeing that pendulum switch back, and I suspect you're probably hearing lots about the same pendulum switching back as it relates to hip preservation.
Absolutely, it is interesting to see, and of course, maybe we'll then run back and swing it back to, recon, in the future. But that really has been where I've parked a lot of my career focus in, because it really is a growth area, and there's a chance, to impact the field as it was, doubling in volume and doubling in academic productivity every 3 to 5 years. So trying to steer the field with the advice and of yourself and other colleagues working together to, really produce high quality evidence was the focus.
Well, let me ask you this then. What are you reading these days? Is there anything that you might want to share about some work either that you've done or work that is happening that could be of interest to orthopedic surgeons interested, in sports medicine broadly, but also in hip preservation?
Well, I think that, full disclosure, I was the PI, you were my co-PI. I think the first trial really evaluating the efficacy of surgical correction of FAI morphology and its outcomes is a big study. And that was, although electronically available late last year, was officially published in January of 2021 in the American Journal of Sports Medicine. So really helping us understand what the natural history is of post-FAI correction surgery, and maybe not even correcting FAI surgery, and helping us, drill down and lay another slab of evidence in, support or at least encouraging us to keep driving forward as far as an evidence-based approach to managing the hip condition in the young adults, especially femorotabular impingement in this case. So that first trial and the publication associated with it really, I think, showed not only just the importance of the work, but I think it showed that collaboration globally is important. I think that having a team-based approach to solving big problems is important, and addressing problems that we all find commonly in orthopedics is important. So, for me, it was common problem, increasingly recognized. Let's work together as a global group and figure out what works and what doesn't work. So I think beyond just the hard data, the concept of really working together to solve big problems is probably as much of an important piece of it for me.
And remind for some of the readers, so what we'll do is we'll make it sure that we post the advanced clinical evidence summary report on OrthoEvidence at the time we post this podcast, so individuals have a chance to, members have a chance to take a look at the actual paper. But you were involved in a few countries in this particular landmark randomized trial looking at femoroacetabular impingement procedures. So can you speak a little bit to the countries that were engaged in this, and also maybe just give a brief bottom line finding? I know you gave a little bit of a précis, but just for our readers, what was the big take-home message for you in this trial?
Well, I think that, for me, the take-home was that in a young adult without arthritis, but sustaining hip pain due to a morphological problem where you have a ball and socket mismatch, to loosely put it, correcting the impingement and correcting any soft tissue damage, one improves, the quality of hip function and quality of life, and there's a less or a lower chance of revision surgery or requirement for revision surgery if you address the femoroacetabular impingement morphology comprehensively. So addressing the bony problem that sets up the soft tissue problem decreases the risk of recurrence at 2 years. And overall, the quality of life is improved, at least in the first year.
And what countries were involved in recruiting for this trial?
Absolutely. I think we had Denmark, Finland, and Canada, multiple Canadian sites, some Danish, one Danish site, and three Finnish sites. And also we had co-investigators and adjudicators from the United States and other European countries.
Superb. Let me ask you then the final of the three questions, which gets to what remains. So what are the big areas that remain? Now, I understand that, you talked about trends such as big data, virtual medicine, particularly virtual orthopedics, and how we manage and train as being two particular important areas, as well as biologics. Are there specific questions in those areas that are needing to be asked? And I guess what progress do you think is being made to get those questions asked?
Yeah, I think that what we've taken, and I'm speaking from our group, is we'd like to have a comprehensive natural history understanding of what happens to a developing joint. So we have a study called a preview study where we have 12 to 14-year-olds, and they wear a Fitbit-like device for a couple of years, and we track their activity profile and what happens to their hips. Are they developing impingement because they're specializing too early or repeating activity over and over again? So in that critical developmental age, what's happening? And then moving forward to the aging hip, when you have the sequelae of FAI and cartilage damage, we're not trying to investigate what a biological scaffold can do to try and improve the function of the hip. Because I used to hear you can correct the impingement, you can fix the labral tear, but the cartilage, there's nothing you can do. So we're now pushing that innovation agenda to say, working with some industry partners, can we actually fix the pre-senescent disease states in hips that have been damaged as a result of the FAI or the sequelae of it? So I would say, to answer your question in a roundabout way, we're looking at development of this problem. We now know what the surgery can potentially do. But once you've had the impact of FAI and you have the residual cartilage damage, can we actually improve the state of the hip function to prevent it from going into the total hip world?
That's superb. And if you were to think broadly, Femi, in sports medicine broadly, so outside the hip, but including the hip, do you think the next frontier is going to be a frontier of big data? Is it going to be a frontier of data with the use of automation such as robotics, for example? Or do you believe it's a biological era that will transform sports medicine? Is there a broad sense that you're getting when you look at the field?
Yeah, sports medicine overall, I think, and I still do obviously hip work, some knee work and shoulder. I love all sports joints, but we've academically focused on the hip. But I would say that biologics on the whole, the mechanisms are quite complex. So, just understanding osteoarthritis and the genetic inflammatory factors and whatnot. So trying to solve that will still be, investigated, but that certainly will take, I think, a lot of time to really figure out how we can change natural history. I do think big data is where we're headed. And you're now seeing multiple groups aligning, collaborating, collecting the same data and trying to move forward with saying, okay, we have these interventions. We know we have a success rate at a certain rate, maybe 80%, and we have a failure rate, let's say 20%. Well, can we figure out how to, selectively choose those we can, help with? I think also, to be fair, there is a concept of individualization of surgery, and so sports medicine certainly is going in that direction, which is, an individual has a problem, they come to see a practitioner, and we know that this operation may or may not be an option for you. But what about you and your natural history and your alignment and your inflammatory profile can make one operation better than the other? So individualization, certainly guided by big data, is where we're going to try and land, I think, in sports medicine. I think that's going to be emerging concepts, which is really, picking what's best for you based on a lot of information that we have on the back end.
On that note, huge thank you to Dr. Femi Ayeni, who is the chair of orthopedics at McMaster University, and of note is a professor of surgery in that same institution. Dr. Ayeni, thank you very much.